People with heart valve disease may have hardened or leaking valves and feel fine at first, but eventually they may have shortness of breath, fatigue, lightheadedness, or even chest pains. Surgeons have used endoscopic procedures to repair one or even two valves, but three has traditionally been an open procedure.
It's a major surgery, not only because of the central incision and you need your chest bone cracked, but because we need a cardiopulmonary bypass and we need to arrest the heart to work inside the heart.
For the first time in the U.S., Dr. Hene Danesi has operated on three valves through a 1-inch incision, replacing a patient's aortic and mitral valves and repairing her tricuspid valve. Doctors say the endoscopic approach reduced surgical time by as much as 50% and allowed them to keep some patients' hearts beating during surgery.
If you think to an elderly and fragile patient, maybe a more gentle surgical access might be the difference between being alive or death from an operation, so it's a big advantage.
That patient, 63-year-old Karen Russell, was discharged from the hospital a week after surgery. I'm Marty Salt reporting.